talking about stress incontinence or incontinence, either stress incontinence or urge incontinence, and how they are formed, or how do you get them, or how do you overcome them is the bigger question. So when you get incontinence, there's two or three reasons why it happens. One would be if you've torn during the birthing process, so you've delivered a baby and you tore during that process, and because you tore your pelvic floor, you lose the ability to contract it, and then it can cause stress or urge incontinence. So stress incontinence is when you pee in your pants when you cough or sneeze, and urge incontinence is when your bladder is full, you can't get to the toilet in time and it just runs down. You can't keep it in, so it just runs down your leg. If you get a bladder infection, you might find that you become incontinent during that time because the area is irritated, and therefore, again, you might get the urge or the stress incontinence, either or. If you've had injury to the pelvis, so any fractures in the area will cause it, and also any infections or perhaps the other one that you can do is if you've had a hysterectomy, so they do an internal hysterectomy, and some of my ladies have become incontinent after hysterectomy. So men can also become incontinent if they get a lot of pressure on their prostate area or any other injury to the area, and it's not an uncommon thing, so one needs to know what to do about it. So if you don't have money to go and buy yourself a Cepha or a pelvic floor stimulator machine, which is very handy, you would do the exercises on the own. The way you would do the exercises is if you pull up your anus, and in the woman the vagina, and in the men your testicles, you would hold it, and you'll feel when it is weak it will hold and then it will fizzle out. So what you want to do is you want to hold and try and hold it there for 10 counts, and then slowly relax it, and then hold it again for 10 counts, and you would repeat it 10 times. You're aiming to get up to 100 times that you would hold it. If you're wanting that for the urge is to be able to hold it for long for 10 counts and repeat it 100 times. For stress incontinence, you want to hold, relax, hold, relax, hold, relax, hold, relax. So you can practice when you go to the toilet. To help you learn how to do it is when you are urinating, you will cut off the flow of urination for a few seconds. Don't do it more than once because it does irritate the bladder and then you can't pee properly. Okay, so you want to do that. It's totally different scenario if you've got a full bladder and then you pee and it drip, 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 drip. That is where you've got problems. You might have muscle spasms in the abdomen that can cause that. Bladder infections can cause that. Nerve problems in the back can cause that. So if you can afford to, you can get yourself a little machine. This little machine you'll use on a daily basis. You would, for the woman, you'd need to put in a little plug that is oval shaped like so. You'd put KY jellies on the outside of the electrodes that you can see closely here. And those would then be placed, it doesn't matter, in the side like that so that it touches the pelvic floor wall. So ideally you want the metal part to touch in the area if you've torn, on the area that has been torn, so that you can reactivate it because it's direct contact onto that. You need to put the KY jelly in, otherwise you're not going to have proper contact and you're not going to feel the current as well as you do. This then has got two little tokies that must hang outside your body, and this must be flush with the bottom or your pelvic floor part. All right, then you're going to connect it to the electrodes that are part of your machine. And once they are in, you're going to set the machine. Now with your machine, you get a little booklet that comes with it that tells you the different incontinence programs you get. So you would set the program according to what the book tells you to, and you get a stress incontinence program, an urge incontinence program, and a mix incontinence program. And you start off with the basic program and you work through the programs. I think there's about 12 programs or so. When you put it on, you want to switch it on and increase your intensity until it is as strong as you can handle. The reason for this is as time goes by, because you're going to use it for about 30 minutes a day, 30 to 40 minutes a day that you'll have it on. By the time 10 to 15 minutes have gone by, your body has adjusted to the level of a contraction that the muscle is providing, and then it doesn't feel as strong anymore. In the beginning, when you're a bit nervous and you're not used to the machine yet, you can put it on not as high, but as you get along and used to the current and it's not strange anymore, pump it up to as high as you can so that you can get proper contraction. And you will find by using this, it does improve your pelvic floor stimulation quite significantly. For the men, they would get a upright electrode, a round electrode like my finger, that would then go up the anus. Yes, I know it's not that nice, but it does help. So these do work. If you get pain in the vagina during intercourse, you can also use these little pelvic floor stimulators to improve the muscles, because it's often due to muscle spasm in the vagina itself that causes the pain during intercourse. So we then use the machine to help to release the muscle spasm in the vagina, and then pain during intercourse becomes less. You can also massage inside there using a finger in the bath. That will also then identifying it like a clock. So where you got 12 o'clock, 6 o'clock, 3 o'clock, and 9 o'clock. And then you would take your finger and go around and identify where on the clock is it painful, because it's going to be the same place every time. And then you go in there and you'll feel it's about the size of dental floss, small little dental floss knobs like speed bumps that you'll feel. And these are the things that are actually causing the pain. So you would go in there and you just massage the area. You can sit on hot water bottles to help with pain, but the muscle contractions for incontinence, stress and urge incontinence, the machine works the best. All those pelvic floor exercises that you do, you want to try and do it on a regular basis throughout the day. So when you're driving, every robot or traffic light that you stop at, you will do the pelvic floor contractions. And then that's for a good minute that you're doing the pelvic floor contractions. And then you would move on while you're waiting for the kettle to boil, or while you're brushing your teeth, or while you're sitting answering emails. You want to sit and do it on a regular basis throughout the day so that your pelvic floor gets stronger and more active and prevents incontinence either way. So, and reduces pain. So if you have problems, or you know of people that have problems with incontinence, please send this link to them. Subscribe, let's see what other questions we can have answered. And like the channel and see what we can do to improve knowledge worldwide. Thanks for watching this video, and I look forward to chatting to you next time.